Hi, welcome to Ask Ellen. Today we're talking about HRT, Hormone Replacement Therapy. This is a different type of video because I'm usually talking about, topics that I've already talked to people about with my personal coaching. Topics that are common, topics that have come up many times that I can relate to other people and maybe help people along the way. But all about HRT is something that's a little more personal for me. I started researching and getting information about a year ago. And honestly, I wish I knew more stuff earlier. And I don't even know how long the good information has been out there, but I do know that there's plenty of good information out there. I've done a lot of research and I've done a lot of the legwork. I'm not a doctor. I'm not someone who's prescribing something. I'm not telling you what to do. I am not giving you advice. But what I am doing is giving you information. Information so you can be informed. Information that you can take to your doctor if you have more questions so that you can be even more informed. Information so that you can feel a little bit more positive in the next appointment that you have with your doctor. You deserve to have all the information that you can get before you start talking to your doctor. That way you go in with a purpose. You go in knowing what you're looking for. You also go in with better questions because you've already done the legwork. I'm not coming down on the medical industry. It has changed a lot since COVID. You used to be able to call up your doctor and make an appointment, and within 2 weeks you could see somebody. But it's not like that anymore. So it's even more important now for you to get all the information that you can before you see your doctor. Your doctor has a limited time with you. You have a limited time with your doctor. You need that information. You need that time to be spent well, to be spent smarter, to help you the most, and also help your doctor help you the most. Is HRT right for every woman? I don't know. And in fact, I think there are some women that just can't even take it. I don't have all the information, but I do have a lot of the information. And I want to think that maybe I can help a great deal of women who are struggling, who have questions, and who might not even know that this is a solution that can help them. Ask your doctor, get more information, and then you can make the best decision possible for what's right for you and your body. Let's get into it. So let me tell you why I started looking, or how I actually found hormone replacement therapy. A year ago, and this is TMI, I'm sorry, but this is how you're going to understand that maybe if you're going through something like this, it's not the end of the world. So I'm 55 right now. So this was about a year ago. And when I would go to the bathroom and pee, like I did my whole life, I'd wipe, stand up, take 3 steps, and I would have drip, drip, drip. What? What's going on? Okay, that's a fluke. And then it happened again. And it happened again. Now I'm getting a little concerned because this isn't a fluke. It's happening quite often. It didn't happen every time, but it was annoying. And sure, I would use a liner and everything would be fine, but that's not right. That shouldn't be happening. What the heck is going on? So I talked to one of my coworkers. She was a little older than me. And I said, hey, have you ever had this happen? And she says, oh yeah, welcome to getting old. Getting old? I'm 54. I'm not old. I'm 54. Okay, some people might think I'm old, but I don't think I'm old. I don't feel old. I hopefully don't look too old. I don't want to be old yet. I'm midlife, right? I'm mature, but I'm not old. And I wasn't ready to put that old hat on my head yet. So I started looking up information. I started looking at urologists and seeing what they had to say. And I found a great doctor online. She is amazing. Her name is Dr. Kelly Casperson. And I'll link information about her down below. We've never met. I wouldn't mind meeting her because I think she is phenomenal. She has so much information, and especially about women aging and HRT. And she told me, and everybody else looking at her videos, but she told me that this is common. But more importantly, it can be healed or stopped or fixed or whatever word you want to use. All I know is that I took her advice, I looked into it a little bit more, and I started doing something myself. And the problem I was having stopped. The HRT that she was talking about was estradiol. And it's a vaginal cream, and you use it a couple of times a week. And that's because everything is connected. They're all connected. So if you're strengthening one area with a little more estrogen, you're strengthening something else. And I was blown away by that information. More importantly, I was blown away by the success that I had. So it made me want to look up more things. It made me want to take a deeper look into myself and what else can I help? What else can I make feel better or act better, or at least act the way it used to act? Because things were changing. And as they're changing, it's a slow progression. And you just find that you lose yourself somewhere in there. And you forget why or how you lost yourself. You're doing your day-to-day thing. You're going to work, you're raising kids, you're having your life. But when did things start slowing down? When did you stop feeling your best? When did you stop feeling optimal? And that's when you have to look at things just a little differently. I had this one thing, the drip, 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 that was waving a red flag. There's something wrong here. There's something not right here. And that helped me focus on the one thing. But once I focused on that and took care of it, I was then able to step back and look at the other things. I'm 55, as I said, and I'm sure women who are around my age grew up hearing, oh, she's going through the change. I always thought that was funny because I always liked werewolf movies and Dracula things. And anytime I heard the change, I thought of a werewolf changing form and turning into a werewolf. And of course, that's not what we do. Although sometimes it can be so grouchy that maybe we're kind of like a werewolf. But the thing is, we never hear any information about it. We just heard she's going through the change. And what little information we got was hot flashes or night sweats. That's not all this is. The change is a lot, and it has to do with the production of our estrogen inside going down and down and down. How is it affecting our bodies? Well, it's affecting it in many different ways. And I'm going to go through these different things so that maybe you can see if it's happening to you too. So let me just pause for a minute and back up, because I really want to talk about the thing that's probably ringing in the back of your head right now. There is a fear that women get when they think about HRT. And this is not something that I want to just throw under the rug, because it's a real thing. Back in 2002, there was the Women's Health Initiative, where they did a study on women on hormone replacement therapy. The headlines were dramatic. They linked hormone therapy to increased risk of breast cancer, of stroke, of heart disease. Whew. Almost overnight, millions of women were taken off their HRT. Millions of doctors stopped prescribing it. And millions of women stopped asking for it. And yes, fear spread. People wanted to just stop thinking about it. They wanted to put it away. But here's the thing that they didn't talk about. The study primarily involved women around 63 years of age. And that's well past the typical age that HRT should be started. The type of hormone they were using in this study was synthetic. They used an oral equine estrogen, and then they also used a synthetic progestin. These things are not easily accepted into our bodies. Nowadays, we have bioidentical hormone replacement therapy. And somehow the bioidentical part gets thrown out there a lot, but that's what it is. When you use estradiol for your estrogen and you use a progesterone, not progestin, your body knows what to do with it. Your body uses it the right way. Many studies have been done, but the fear from 2002 still lingers. And that's why getting the information and getting yourself educated is so important, so that you can understand that maybe you're listening to the false narrative. Maybe you can get help for things that you need help with. Maybe there's a solution that can help you start feeling better without the risks of the synthetic crap that they were using back in 2002. Remember when you were in school? I think it was around 5th grade or so. All the girls were taken into a room so that we could watch a movie and learn how we're going to become women. We're going to start having our periods. We're going into puberty. And it was a big deal. And they gave us books and pamphlets to read. And we had a whole class and a movie and somebody standing up in front of the class to tell us all about it. And then as you get a little older and you are seeing your OBGYN regularly and you start getting into the age where you think you might want to have kids, oh, there are books on what to expect when expecting and all the information that you need for being pregnant, getting pregnant, having your babies. Then the information kind of stops. Almost like, hey, you did your thing, you had your baby, move on. They forget to give us all the other information about getting older, about what happens to our bodies when all of a sudden the estrogen starts lowering. It starts well before you get into menopause. And that time when it starts declining, that's perimenopause. Sometimes you hear about it and sometimes you don't. And I'm actually amazed at how many people don't know about perimenopause. Perimenopause can start at least 10 years before you get into menopause. And depending on who you talk to or who you're getting your information from, some people say that you hit puberty and you are fertile ages and then you're in perimenopause, and when you have a year that you go without having a period, that once you hit that year mark of no period, that one day is menopause. After that is post-menopause. And that's where it gets a little fluffy, because sometimes then people just say, once you hit menopause, you are menopause. So take it or leave it as to how you want to define it. But it's the perimenopause part that I want to talk about, because that's where I am right now. I have not gone into menopause yet. But I do know that I had a decline for many years before I started looking into things. And that's why I really thought this is such an important video to have, to educate people. Why does it matter so much whether or not you're on HRT or not? And why did I want to make a video about it? The thing that I learned doing all my research was that we have estrogen receptors all over our bodies. Wait, what? We do? So you're telling me that if I have receptors all over my body that's looking for estrogen, but my body isn't producing it the way that it should, then the receptors aren't receiving what they want? Light bulb moment. It made me say, how do I not know this? Why wasn't I given this information before? Think about it. If you were on a team, for say a sports team, and they give you a glove and a catcher's mitt and a mask and say, stand behind home plate, get ready to receive the ball. Obviously, I'm talking about baseball. But if the rest of the team go play basketball, you're gonna sit there like an idiot, waiting, until finally you're gonna realize that that ball isn't coming. And when you realize that, what are you gonna do? Are you gonna stay in that squat position? No, you're gonna get up and leave. Where do we have these estrogen receptors? We have them in our brain. We have them in our heart. We have them in blood vessels. We have them in our bones, in our skin. We have them in our joints. We have them in our bladder. We have them in our gut. And we have them in our muscles. All over our body, we have receptors that are waiting and asking for estrogen. I need it. I want it. I can't work right if I don't have it. Light bulb moment for me. And that's where I said, no, I need this. This is important to me. So that's when I started connecting the dots. When our body is in a decline of estrogen, all the other parts in our body feel the effect. They too start feeling the decline. They too stop working the way that they should because they don't have what they need. Why isn't this talked about more? It doesn't make any sense to me, which is why I need to shout it out so that you can at least have the information. Do with it what you want. I know what I'm doing, but you do you. But let's talk a little bit more about that. So like I said before, we heard growing up that menopause or going through the change was hot flashes and night sweats. And I have no proof here, but I like to think that it was because of the Women's Health Initiative that they just simplified it. Oh, it's just night sweats, it's just hot flashes, and they made it so nothing so that taking women off HRT made sense. Oh, you don't need it. It's only these things. Turn on a fan, you'll be fine. Just breathe through it, you're fine. Have a little cold water, you're fine. By simplifying it, it makes it like it's not that big of a deal. But it is a big deal. And we found out why, because we have those estrogen receptors all over our body. But there are so many more symptoms that women are experiencing because of that drop in estrogen. Sometimes they don't even understand that all these things are combined in the one loss of estrogen. They just think that there's something wrong with them. They just feel off. They don't feel like themselves. And there's a reason for it. Your whole body is going through something. I'm going to read off my list because I don't want to forget something. But here's a list of other symptoms that some women can experience during perimenopause. Brain fog, memory lapses, word finding issues. Hello, brain things, right? Anxiety spikes, mood instability. Yep. Sleep disruption, huge. I can't tell you how bad my sleep was before I started HRT. Joint pain and stiffness, increased cholesterol, vaginal dryness, painful intercourse, frequent UTIs, bladder urgency, thinning hair, skin changes, slower muscle recovery, bone density loss. I don't know what you're thinking right now, but I know that when I read that list, it breaks my heart. It breaks my heart knowing that people don't know that they could get relief, that maybe some of the symptoms can be treated, that maybe it's not this big, dangerous thing, that it's just our estrogen isn't high enough, that our depletion of estrogen is causing some of these symptoms. If you're experiencing any of those issues, it might be hormonal. I'm not telling you it is. I'm not telling you that increased estrogen will fix everything, but I'm giving you information that you can then take to your doctor and say, I am experiencing these few things. And I have learned that in perimenopause, women experience these things. Could I be a good candidate for hormone replacement therapy? Is this something that I should consider? Is this something that we can talk about? What exactly is HRT? HRT is hormone replacement therapy. And it pretty much is exactly what the words say. They're replacing hormones into your body that your body just isn't producing at the levels that it used to produce. I don't think you have to worry about getting any levels of estrogen in your body that makes you feel like you were 13 again. Personally, I wouldn't want to be 13 again, but they will give you some added benefits and some added estrogen in your body so that maybe the levels aren't as low as they were before you started. There are different kinds of estrogen. I'm not a medical person, so I'm not even going to get into that part. I'm going to keep this more layman terms so that you understand it in an easier way. Talk to your doctor, get information, and they can tell you where I kind of dropped the ball if that's the case. But I do want you to know that there are different forms that you can take and that your doctor can prescribe to if you want to start hormone replacement therapy. You can do oral estrogen. They have transdermal patches. They have gels. They have creams. They have vaginal estrogen. And for women who still have a uterus, usually they will combine therapies so that you have estrogen and also a progesterone as well. One protects the other, so talk to your doctor again. I do know that doctors tend to lean towards the transdermal type, like a patch or a gel. And the reason for that is it bypasses the liver. So it doesn't have to go through the whole system of the body. You get the help the way that you need without having going through the liver first. But some people need an oral estrogen. Again, this is where you talk with your doctor and you discuss risks and you discuss the benefits, the pros and cons, and you make the decision with all the information that you can have. I can't tell you which way to go. I can tell you that I am on a patch for my estrogen, and I also take a progesterone pill every night as well. There's no one-stop shop for hormone replacement therapy for women. It's all different. You need to talk with your doctor. You need to be able to talk with your doctor openly about what you're experiencing, how things are working. If you start a therapy regime, how's it going? How does it make you feel? Did you get any relief? Are things worse? Are things better? This way they can move things away in a different way so that you can have the benefits that you need and you want. This whole video is for information so that you can be more informed, more educated for when you talk to your doctor. Another thing you want to talk to your doctor about is timing. It used to be that people would start taking hormone replacement after everything stopped working, once you hit menopause. But research now shows that starting HRT in perimenopause lowers your risk of heart disease. That's important to me. And that's why I thought that was very important to share with other people. Again, talk with your doctor. Find out what's right for you. Maybe your family has a history of heart disease. I don't know anything about that. And I don't know what your added risks are. But you need to be able to talk with your doctor about the risks pertaining to HRT and your health. When is a good time to start? When is it optimal for you to start? And at what level should you begin? Should you be on a high dose or a low dose? Should you just be on an estrogen, or do you need progesterone as well? And let's not forget about testosterone. When does that come into play, and does it? To be honest with you, I'm still not as educated as I need to be on testosterone. I have learned that women have more testosterone in their body than we do estrogen, normally. Why aren't we talking about this on a regular basis? That does not mean that if I start taking some testosterone replacement, I'm going to be all bulky. But if I'm depleted in it, it might help in other factors. I'm doing more research now on testosterone, and I will keep you informed as I learn more information. But please talk to your doctor as well. Get the conversation started. Maybe it's not right away. Maybe just work on one part first. Maybe if you're having the sleep problems, you tackle that first. Get that working so that you can check it off your box. Have the good night's sleep, and then talk about other forms later. One of the biggest challenges that women face is finding a doctor or a provider to help you through this whole decision process. A doctor who can prescribe something and know what they're prescribing. a doctor who's educated in perimenopause and menopause care. Just because you're going to your OBGYN does not mean they know how to prescribe HRT. I didn't realize this right away. I didn't know this was a thing until I started talking to my doctor, and I was given kind of like, well, we can discuss that later, because they just aren't educated in it. I don't understand the why, probably because it takes on even more education. I honestly don't understand, but that's not for me to understand because I'm not in the medical field. However, finding someone can be difficult. I'm in the US, I'm in Massachusetts, and I finally found Midi Health. I'm not affiliated with them. They don't know I'm talking about them right now, but Midi Health has been a lifesaver for me. They are a online telehealth focused company, and they have doctors who know all about perimenopause and menopause. They help you through it. My first appointment lasted almost an hour. An hour. When was the last time you were able to talk to your doctor for an hour? When were you able to talk about all the things that just aren't right? Your sleep problems, your joint pain, your brain fog, your forgetfulness, the weight that you keep gaining, your cholesterol going up, your moodiness, your gut problems. Being able to talk to a doctor and having that person actually listen to you and explain to you that it's not in your head and tell you how maybe you can get help, it's a godsend. It's so important. I don't know other places over the country, but I do know that Midi Health is available in all of the 50 United States. It takes insurance, so if you have insurance, odds are you can go through your insurance with Midi Health. If you can't get coverage with your insurance, you might want to advocate for yourself and ask, hey, I want to be able to use this company, please consider it. Or maybe go through Midi Health and see if they can help you get your insurance on board. It has helped in such a great way for me, and that's why I'm sharing that information for you. I'm not affiliated with them. I'm not sponsored by them. I'm not getting any kickbacks from them. I just found a solution that worked for me, and I wanted to be able to share it with you. This video is not about convincing you to take hormone replacement therapy. It's about making sure that you make decisions for yourself that's not from outdated fear. It's about understanding that estrogen and the lowered amount of estrogen in our body, that it affects far more than what our well-intentioned mothers and grandmothers told us. It's about helping you ask better questions of your doctor so that you can make the right choice for you, so that you can decide whether or not it's a good idea. It may not be for you, and you may not be a good candidate because you just can't take them for whatever reason. I'm sure there's a lot that I don't know. After all, like I said, I'm not a doctor. But for all of you who are in the same boat that I'm in, I want you at least educated enough so that when you do talk to somebody, you know what to expect from them. Or at least you have a better idea as to what you're asking. And to realize that some of your symptoms may be easily helped to make you feel better, to help you feel better. This video might be your first step in learning about HRT. This might be the first time you're ever hearing it. And maybe you're experiencing some of those symptoms that maybe now you have enough information so that you can talk to your doctor and get the help that you need. Maybe this helps open the line of communication between you and your doctor. Only you can tell yourself that you can live with it or you don't want to live with it. Only you can say, I don't want to get old yet. I'm not ready to be old yet. Maybe that's how you're feeling right now. That's how I was feeling. I don't feel that way anymore. I feel better. Am I 100% perfect? Nope. We're still going through it. We're still figuring it out. We're still checking my levels. But I definitely feel better than I did before I started. And feeling better already is better. I have better sleep. I'm not as hairline triggered with my moods. They're still there and a work in progress, but they're not as as they used to be. And my brain fog is definitely lifting. And all those things are very important to me. What are the things that you're going through? Did I mention any of the symptoms that you're having that maybe now you're thinking it's not just in your head? Did this video give you a light bulb moment? I'd love to hear about it. You don't have to suffer in silence because you just think it's aging. This isn't aging. This is estrogen depletion. And our lifespans are a lot longer now. I weighed the pros and cons for me, and I decided that HRT is the way to go for me. Maybe it's not right for you, and that's okay. But I at least wanted to give you the information to make you have a nice informed decision on your part. Talk with your doctor and see if maybe your doctor thinks the same way you do. There are 3 doctors that I found on YouTube who I think are fabulous. And of course, that's my personal opinion, but I wanted to give you their names, and I'll put it down below as well so that you can look into their YouTube channels and get more information if you want more information told by a doctor, not just some lady who likes to chit chat with people. These 3 doctors I find invaluable. I think they're great. I don't know any of them. They don't know me. I would love to meet them, all 3 actually, in person and have a real conversation with them. And maybe someday I will. Maybe someday I'll be lucky enough to do that. But until then, I'll give you their information so that you can get a little bit more information should you want it. Should you want to get even deeper into this whole thing before you talk with your doctor. The first person I mentioned before, and that's Dr. Kelly Casperson. She is amazing, and I can't say anything better about her. You will love her. You'll think she's great. She's so well informed, and she's very matter of fact. She has a book out as well, and her book is great. I'm not plugging that for her, but look into her. Another doctor with a ton of information, but she tends to be a little bit more sciencey. So if you don't follow science very well, she may go over your head. There are sometimes I have to rewind her videos and watch them again so that I can comprehend everything she's saying. She has a slew of information, and it just keeps coming out. She's fabulous. But her name is Dr. Felice Gersh. She's amazing. And the third doctor, and this is another woman who I respect so much. I love her frankness. I love her honesty. I love the way she delivers her information because she sounds like your friend. She sounds like someone who truly cares about you. And that's why I click with her. And like I said before, I'd love to sit down and have a cup of coffee with her so that we could just discuss things. She is so great. Her name is Dr. Rachel Rubin. And again, I'll put their information in the description so that you have it. I encourage you all to go to their websites and see all about them and get all their information as well. You will be really happy that you did. My name's Ellen. This channel is Ask Ellen. We talk about things that happen in our lives. This was a little different because this was more something that was happening in my life that I wanted to talk about. But what is it that you want to talk about? Let me know in the comments. I'd love to make a video on it. This is Ask Ellen. Real questions, real talk, real change. I'll see you in the next one.